Hello all, myself Murshida Yasmin, Assistant Professor from SNS College of Physiotherapy. Today's topic is about therapeutic ultrasound. In this video, you can understand the overview of fundamental concept of ultrasound and acoustic energy principles used in the therapeutic ultrasound. This picture shows the advanced mini ultrasonic machine which is used for therapeutic purposes. Ultrasound refers to sound waves with the frequencies above the audible range of human hearing, which is more than 20 kilohertz. The infrasound is below 10 hertz and the hearing range of human ear is between the 10 and 10,000 range of hertz. And the ultrasound is usually more than 20,000 hertz, which is used particularly in the therapeutic purpose. Therapeutic ultrasound is a modality used in physiotherapy to promote tissue healing, reduce pain, and improve tissue extensibility. The ultrasonic imaging waves travel parallelly to imaging the object which we have to detect. The ultrasound therapy, the waves converge together and focus on the particular area of the object to promote the tissue healing. The sound waves are the mechanical vibration that happens in the medium to travel as a sound wave. Ultrasound waves are longitudinal waves. The longitudinal waves are unidirectional that happens as a compression and rarefaction of the longitudinal waves. The frequency and the wavelength of the longitudinal wave, which is an ultrasound wave, is the number of cycles per second in hertz is called as frequency, and the distance between two consecutive compression and rarefaction of the sound wave is defined in the wavelength. Usually, the therapeutic ultrasound has two frequencies, 1 MHz and 3 MHz. Principle of acoustic energy used in therapeutic ultrasound is transmitted through the molecular vibration within a medium, that is transferring energy from one molecule to another. Once the sound wave enters the tissues, the sound waves creates an agitation which is done by the compression and rarefaction of the sound waves, which creates an agitation in the molecule. That agitation is transferred from one molecule to another. Acoustic impedance, it is a resistance a material offered to sound wave transmission, which is referred to as Z is equal to density into velocity. So, a distance sensor with the wave traveling towards an object, there will be a reflected wave called as echo, that is called as acoustic impedance. Reflection and refraction is the major principle that is used in the therapeutic ultrasound. Reflection occurs at an interface with a different acoustic impedance. Refraction is the bending of the sound waves as they pass through the media of different intensity. In this picture, you can see the ultrasound wave is traveling towards an object. If the wave is reflected away, it cannot penetrate inside the tissue. If the wave is transmitted in the direction of the ultrasound wave, it can transmit clearly inside the tissue. Or else if the wave is refracted away from the targeted area, there also the absorption happens. Absorption of the ultrasonic wave is a conversion of ultrasonic energy into heat within the tissue. The rate of absorption increases with the increase in the frequency. Attenuation is the loss of ultrasound intensity as it travels through the tissue due to absorption, reflection and scattering. Attenuation is basically because of the absorption and scattering. Absorption happens in gases, liquids and solids homogeneous. Scattering happens in heterogeneous solids, real steels and alloys. Thermal effect and non-thermal effect of the ultrasound happens because of the increase in the tissue temperature, which leads to increased metabolism, thereby reducing the pain, and enhanced tissue healing happens, which includes cavitation and acoustic streaming, which promotes cellular activity and the tissue repair. The thermal effect has happened because of the increase in the temperature of the tissue. Non-thermal effect happens because of the shock wave, shear stress, microstream and radiation force. All these happens because of the therapeutic ultrasound. Cavitation is nothing but the formation and oscillation of the small gas bubbles in the tissue. Stable cavitation aids healing, unstable cavitation can cause damage. Stable cavitation occurs once the ultrasound waves properly compress and rarefact inside the tissue. Once, if the compression and rarefaction does not happen in a proper way inside the tissue, the molecules abnormally agitate together and that forms a small gas bubble that may damage in some stages that causes collapse inside the tissue. You can see in this picture there is acoustic cavitation. Ultrasound transmitter will be here. Once the ultrasound is transmitted from the transducer, it will be traveling like a wave and the bubble forms. The bubble grows in a successive cycle, and once if it reaches the unstable state, the violent collapse happens inside the tissue. So this can be a danger to the tissue. Acoustic streaming, steady movement of the fluid caused by ultrasound, enhancing cell membrane permeability and nutrient exchange, is the acoustic streaming in the therapeutic ultrasound. To summarize about this topic, ultrasound is an effective therapeutic tool that uses acoustic energy principle to promote the healing and recovery in physiotherapy. So ultrasound is a core therapeutic tool using acoustic energy. Acoustic energy principles are foundations of ultrasounds functionally and healing and recovery, which is a desired outcome of ultrasound therapy. And in physiotherapy, the ultrasound application is most widely used to treat many of the conditions. Thank you.